A phobia is when you have an intense or an overwhelming fear and anxiety in certain situations or when you come into close contact with certain objects. While phobias can involve same things like ordinary fears, the effect of phobias are usually severe. In most cases, people with phobias critically limit their lives in order to avoid encountering what they fear. You have your phobias, I have mine. Let's discuss. Hello, you're all welcome back to my channel Time with Miss Joycelyn. If today is your first time, kindly subscribe to this channel for me and then you put on your notification bells for new updates. We are discussing phobias today. Stay tuned and enjoy. Phobias are a type of anxiety disorder and there is one diagnosis for almost all of them. That is specific phobia. There is only one type of phobia called agoraphobia, which is a specific diagnosis on its own. When you encounter something that triggers your phobia, you will feel an overwhelming or intense fear and anxiety. You might keep functioning as a human being though, but doing so will be very difficult. Because phobia, including the feelings of fear and anxiety it causes, affects everyone differently. There's no set number of fears. However, experts group the number of fears into 5 main categories. One is animals. Under animals, you may have the fear of alligators, dogs, or snakes. When we talk of natural environment too, you may have the fear of storm, water, or heights. When we talk of the third one, which is medical procedures or injuries, one may have the fear of needles, injuries, or pain. In situations too, you may have the fear of driving, flying, or being in an enclosed place. Then the number 5 refers to others. The others includes children having the fear of choking or the fear of clowns. Under the category of animals, these are some of the most common phobias. Number 1 is arachnophobia. That is the fear of spiders. We have cynophobia, the fear of dogs. Entomophobia, that is the fear of insects. And ophidiophobia, the fear of snakes. And the natural environment, we have acrophobia. That is the fear of heights. Agoraphobia, the fear of public places. Aquaphobia, the fear of water. And then astrophobia, that pertains to thunder and lightning. So it is the fear of thunder and lightning. Under blood, medical procedures and injuries, we have algophobia, that is the fear of pain. Dentophobia, fear of dentists. Hemophobia, fear of blood. And then trypanophobia, that is the fear of needles. Agoraphobia is a different or separate diagnosis because it can have several potential triggers. And the diagnosis of agoraphobia requires that you have multiple types of triggers. Under the category of situations, we have aerophobia, that is the fear of flying. Amaxophobia, the fear of driving. Claustrophobia, that is the fear of enclosed spaces. And nyctophobia, the fear of the dark. Others are coulrophobia, that is the fear of clowns, especially in children. We have emetophobia, just from the word emesis, this is the fear of vomiting. Also the fear of fire, that is pyrophobia. We also have trypophobia, that is the fear of clusters or groups of holes. How common are phobias? In reality, phobias are not really common. While people can describe that they have a strong fear for things like snakes or heights, it is not the same as a phobia. Phobias actually are not very common. The rate for specific phobia can vary by age, but mostly people develop this before age 10. Also, specific phobia rates tend to decrease as people age, and women are twice as likely to develop phobia more than men. Phobias can cause you to have or experience physical, mental, and behavioral symptoms when you are exposed to the feared object, the situation, or when thinking about it. The mental symptoms you can get when you are exposed to your phobia or a feared object include an intense or overwhelming fear, 2, panic or feeling the need to escape, feeling like you are in an immediate danger or feelings of disconnection from your own body. Physical symptoms are effects that affect your body directly. And these are some of the symptoms or physical symptoms you may have when you are exposed to your phobia or a feared object. 1, shaking or trembling, heart rate and activity changes, pallor, you may be sweating or you may be having chills. You may have nausea, stomach ache or stomach upset. You may have tightness or pain in the chest, fainting or narrowed vision, just to mention few. Behavioral symptoms are ways by which we change or don't change our lifestyle, routine, or habits. So, some of the behavioral symptoms you may get when you are exposed to your phobia are: 1, you try to go out of the way in order to avoid your triggers. An example is avoiding regular medical or dental care because you are afraid of needles and dentists. Number 2, you deliberately change your life in order to avoid triggers. An example is you moving out of a coastal area because of the fear of hurricanes. Number 3 is avoiding life changes, especially positive ones. An example is avoiding buying a house or taking a job somewhere near the view of a river, all because you have the fear of water, swimming, or drowning. Now let's talk about symptoms in children. Yes, children can also develop specific phobia, and they may show symptoms in different ways, such as crying, tantrums, or emotional outbursts, freezing or holding still, clinging or being inseparable from someone they feel is safe. So you may ask, what causes phobias? Phobias happen when the brain takes fear to extreme degrees. Under ordinary circumstances, these emotions can be helpful and protective because they are your brain's way of telling you that there is something wrong or you might be in danger. Traumatic experiences, genetics, informational transmissions, and learned fears. Can phobias cause complications? Yes, they can. Phobias can have a long-term effect on your physical and mental health, especially if you frequently encounter your triggers or have severe effects. Mental health conditions that are more likely in people with specific phobia or agoraphobia include bipolar disorders, anxiety disorders, depressive disorders, personality disorders, substance use disorders, and then somatic symptom disorders. Physical complications also include a heart disease, chronic obstructive pulmonary disease or COPD, dementia, and then Parkinson's disease. Thank you all for watching. Phobias are treatable, and seeking professional advice or help is the first step towards overcoming your fears. Don't let your phobia hold you back from living a fulfilling life. If you found this video helpful, kindly hit on the like button, be sure to comment, and then you subscribe to this channel for more mental health content. I'll see you in my next video.